thank Sir for inviting me for this good event. It's a bit difficult to summarize all the initiatives which the Tamil Nadu government and Government of India have taken to make the consumers, basically the poor people who visit government hospitals, better off in terms of satisfying their health needs. Nevertheless, I'll try to use this 20 minutes to focus on three different distinct areas where government has had a very important role in healthcare sector. The first, in terms of designing its policies and tuning its interventions in line with the changing health need of the population, that is the consumer group. Number two, by creating infrastructure and organizations, how it has made not only its own institutions but also the private sector work with it together in satisfying these needs. Three would be what Sir touched up in his introductory speech on specifically on health insurance, because health insurance is increasingly taking up a larger pie in the overall healthcare delivery system, and how the government initiative in health sector has helped both our hospitals and private hospitals as well as the various service providers in enhancing the quality of healthcare. Coming to the first point, that how government initiatives have been designed and tuned over a period of time. I mean, when I was a medical student way back in 1992, the focus was not on institutions like where we are standing now. The focus was, the discussions used to be on controlling infant deaths due to diarrhea, controlling morbidities due to polio, or other, all the other communicable diseases which used to be running rampant in our society. And all the interventions which the government designed, say 2 decades or 3 decades back, were focused on that particular, prevalence of illnesses which took a toll on this population. But say 2 decades down the line, our focus has totally changed. Today, if you, I don't know, some of you might have read the latest report on the global burden of disease on India and other developing countries, especially in the context of a state like Tamil Nadu. All the diseases which we used to associate with a very high rate of morbidity or mortality are today have become insignificant. Today, the killers in our state perspective, both from our consumers or government perspective, are incidences like road accidents, non-communicable diseases, and say self-harm. People do know self-harm is a very leading cause of death in a state like Tamil Nadu. All these events which are rated as the number 1, number 2, number 3 causes of morbidity and mortality today were existent even 2 days before, but their shared profile in the overall health scenario was totally different. So the government has also totally changed its method of intervention, in the sense that today the focus of government is more on preventing accidents, treating cardiovascular diseases, treating neurological diseases, cancer diagnostics, and all the non-communicable disease interventions. And qualitatively, how these interventions differ from the earlier interventions are in terms of both the investment which is needed and the point of intervention. When we used to intervene for diarrheal diseases or pneumonia, the focus was more on awareness building, sanitation, which were more community driven interventions. Today, when it comes to non-communicable diseases, we intervene by investing heavily in infrastructure. We invest heavily in terms of awareness for preventing the disease, in terms of lifestyle modifications. To some extent, very well, there is a very clear law of diminishing returns when the investment keeps on accumulating in a sector. I would say that many government initiatives are slowly reaching that particular diminishing return point in their original point. I mean, all of you might have read newspaper reports that Tamil Nadu is one of the top 3 states in reducing, say, infant mortality or maternal mortality. Today we are basically reaching a plateau there, and we will continue to make improvements. But the improvements which we make in terms of reduction may not be as high as in the past decade, because the type of factors which contribute to these problems have qualitatively become more complicated, which means that they require more complicated interventions, high cost interventions, which requires a lot of skilled manpower as well as capital investment. So we would continue to try on those areas, whereas these new emerging areas is what is keeping our government health system preoccupied with. The second point is how government of Tamil Nadu and government of India have leveraged the other stakeholders, because there's always this great debate about public healthcare versus private healthcare system. I think many consumers here also have been indulging in heated discussions in newspaper columns and this thing. The government of Tamil Nadu's strategy to tackle this particular issue has been to build the public healthcare system in such a way that the system takes care of the bulk of the healthcare needs of the consumers, and we co-opt private sector players in areas where our abilities in terms of manpower or in terms of infrastructure are inadequate at this particular point to fulfill a need. And while we continue to engage private sector in all these endeavors, the government would never shy away from building its own strengths. How it builds the own strength is by capturing market share in key interventions. I'll give you two good examples which can help you to understand this. There was a last NSSO survey on out-of-pocket expenditure for consumers in terms of various activities. That is, in terms of a simple OP healthcare, when somebody accesses a OP healthcare, or somebody accesses a hospital for a small illness. It might be a fever or a body pain or something. It would be of interest for all of you to know that the out-of-pocket expenditure for patients who access government facilities is the least in the country for Tamil Nadu. But the out-of-pocket expenditure for the same patient who accesses private sector in Tamil Nadu is not the least, but it is not the highest also. We fall somewhere in between. The out-of-pocket expenditure for a mother who delivers in a government hospital is again the least in Tamil Nadu in the entire country. But again, in the top 10, not the highest, but in the top 10 in the private sector in the country. How does government of Tamil Nadu achieve this? The achievement is purely possible because of its dominant market share in the system. Today, Tamil Nadu's government hospitals account for 2/3 of the deliveries which happen in the country, in the state. My organization, Tamil Nadu Medical Services Corporation, accounts for 40% of the CT and MRIs which are taken in this particular state. Somebody was commenting to me, a very senior officer who retired from Government of India was commenting to me how Tamil Nadu's CT scan rates in private sector are very low. So I told Madam, thanks for your compliments. I said that why are you taking it as a compliment for you? I told him, Madam, their rates are low because I fix the rates. My organization, that is the Tamil Nadu government, by its market share, it fixes the rate. That is, when I fix the rate at X, the private sector, which caters to a different group of consumers, cannot fix a rate which is far away from X. Of course, they will pitch it at higher than X. I won't fault them for it, but they cannot pitch it as 4X or 5X. The moment the differential between X and Y becomes wide, there will be a definite flow of patients from there, from here. Then in a lighter vein, I told, Madam, if TNMC sneezes, these centers will catch cold. So, by capture, this would not be possible if my market share in the diagnostics is say 5%. But when the market share in diagnostics is 40%, I'm purely telling this from a CT and MRI point of view, I have sufficient presence in the market to determine the price, and as you know, government always fixes the price in favor of consumers, but in such a way that the private sector players also have an role to play. I mean, government can never take a view that we will dominate the market and we will make private players out of the market to favor the consumers. I mean, everybody has their own place there, but the key is to ensure that the government gets a sufficient market share to help consumers against private sector. I mean, it's a known fact that private sector has to make profits. There is no private sector organization which can survive without profits. And consumers also have to have a reasonable rate, and government acts an arbiter between this particular, in this particular triangle by increasing their share in the service and giving the consumer an option to attend public health, to enter the public health system if the private sector prices the service at a very higher level. So this particular arrangement has helped immensely. I would say that it has helped private sector also. Although superficially, if some evaluates it, then people may see a lost opportunity in this particular aspect. That when government fixes the prices is very low, how does that then the private sector survive? Actually, when government is able to guarantee a service at a very reasonable price, there is an immense demand for the services which is generated. If you see the profile of, I will give you a very small example. Tamil Nadu has a population of 7.5 crores. I can't name a state, but we have a neighbor which is a comparable population, marginally lower, economically and socially comparable to us. In Tamil Nadu, the government hospitals this financial year,